This video is an ethical and legal request for your informed consent. Before undergoing the medical procedure called endoscopic ultrasound, EUS for short, your doctor wants you to understand why the procedure is needed, how it's done, and will explain potential risks, complications, and benefits associated with the procedure as well as its reasonable alternatives. To help you better understand EUS, let's start by looking at the body's digestive system. This system is also known as the gastrointestinal tract, GI tract for short. It includes the mouth, throat, esophagus, stomach, small bowel, and large bowel, which ends in the rectum. The upper GI tract is the part of the system that begins at the esophagus and ends at the upper end of the small intestine called the duodenum. EUS allows doctors to look inside the body's digestive system through the use of an endoscope. It provides a much more detailed view of certain organs than standard ultrasound testing can provide. This is an EUS endoscope. On one end is a small ultrasound device that's guided by a set of hand controls with precise movements. A small opening on one end allows a biopsy needle to pass through if necessary. Your doctor will be able to obtain ultrasonic images of areas around the esophagus, stomach, duodenum, pancreas, liver and biliary system, and lymph nodes in those areas. A rectal ultrasound scope can obtain ultrasonic images of structures and tumors in the rectum. The most common reasons for an EUS include, but are not limited to, evaluation of tumors and other abnormal growths in the GI tract, evaluation of jaundice, diagnosing suspected tumors of the pancreas or other areas of the GI tract, to get tissue samples of lymph nodes and the evaluation of malignant tumors, staging of malignant tumors, to check the integrity of rectal muscles in cases of suspected rectal dysfunction. EUS rarely causes discomfort. Prior to and during the exam, your doctor will give you intravenous medications to reduce anxiety and to provide sedation. These medications might make it difficult for you to remember the exam. Sometimes general anesthesia is used, in which an anesthesia specialist will place a tube into the windpipe to facilitate breathing during deep sedation. Some of the risks of sedation include depression of reflexes, decreased breathing, and decreased blood pressure. Side effects and complications are rare but can occur during or after the procedure. To ease the scope's insertion, a mouth guard will be placed between your teeth. EUS is usually safe and associated with very low risk. However, you should be aware of any possible associated risks. Risks include pain and discomfort, a tear or perforation of the esophagus, stomach, or intestinal wall. Bleeding can occur from scope trauma, dilation, biopsy, or polyp removal. Pancreatitis, biopsy of an organ or tissue that was not intended to be biopsied. Other risks include loss of teeth, hoarseness, cardiac or respiratory complications, reactions to medications, infection, irritation or phlebitis at the IV site, possibility of missing a lesion or cancer, and other risks specific to your physical and medical condition as discussed with you by your doctor. Extremely rare risks include death, brain damage, disfiguring scars, paralysis, loss of function of an organ or limb. EUS is considered very accurate. Most doctors consider the procedure cost-effective with the least risks. However, there are alternatives such as X-ray tests and scans, MRIs, passing a biopsy needle directly through the abdomen, and exploratory surgery. The decision to undergo EUS is yours and should be based on your doctor's evaluation of your particular problem as discussed with you. If you decide not to have the procedure, be aware that your doctor may not be able to properly diagnose or treat your condition, which could worsen or possibly spread. If you have any questions about your need for this procedure or about the procedure itself, ask your doctor. This video can be helpful in your right to informed consent for EUS, but should not be considered a substitute for discussion with your doctor.